I'm going to go ahead and share my screen here. So, gosh, what an amazing turnout. Thank you all so much for joining us today. I want to say again, thank you so much to Shelter Animals Count for providing fantastic data for this workshop and to all of us in the industry. And thank you so much also to Hills. What an incredible partnership with Hills. They really are identifying the kind of opportunity spaces in animal welfare and just diving in head first. So I appreciate so much that they see the value in content like this. If you don't know me, my name is Hannah Shaw, and I am mostly known as the Kitten Lady. I am a humane educator who focuses specifically on education for people who are caring for neonatal kittens. So I work with community members, I work with shelters and people in the animal welfare industry to improve outcomes for our tiniest felines. I work a lot with animal shelters. I actually just got back from a 9-city tour of working with shelters, doing community events, doing advanced trainings and professional trainings, all centered around the care and protection of small kittens. I'm also an author of several books, including Tiny But Mighty, which is my guide to saving the lives of kittens, as well as Cats of the World, which is my most recent book about global cat welfare. And kittenlady.org is my website where you can learn a lot about kitten care. It's filled with articles and a library of videos that are usually accessed by people who are doing the care themselves. So foster parents can go on there and learn all sorts of things about caring for kittens. I'm also the founder of Orphan Kitten Club. We are a 501c3 nonprofit. We're based here in San Diego, but we are national in scope. And I want to tell you a little bit about us just because I will be referencing some statistics from our organization today. So Orphan Kitten Club is, we are partnered with shelters and rescues in about 100 communities right now. And I'm very proud that we have funded over $3.5 million in kitten programs in shelters and rescues across America. So we partner through a variety of initiatives. And last year, we impacted over 18,000 kittens in the United States. So the biggest program that we have by far is our Mighty Cat program. It is a grant program specifically targeting kittens 0 to 8 weeks old and improving their outcomes in shelters and rescues. So I want to just quickly share what that does because we have an amazing opportunity to get a lot of data out of these grants and understand kind of what initiatives are helping. So this program, basically what we do is we partner with shelters and rescues to identify their opportunity spaces, whether that be that they need more kitten supplies, they need infrastructure in their shelter, they need kitten-focused staff, and we will fund and mentor those opportunities for them. So our biggest grant type right now is actually kitten-focused staffing, something that I'll talk a little bit about. Oh, hi. I am joined by kittens today, so there may be some mayhem. Hopefully nobody will close my screen or anything, but here we go. This is who we're talking about today. This is one of my current fosters, but they actually are quite big now. These guys just hit 8 weeks and they actually got spayed and neutered yesterday. Hi, wow, everybody's coming over. So that is a little bit about us and what we do. Hello, are you guys gonna behave yourselves today? I sure hope so. So I work with kittens specifically in the 0 to 8 week category. And today I'm going to refer to them as, 0 to 8 week olds, or I might refer to them as pre-adoption age kittens. When I say pre-adoption age kitten, I mean kittens under 8 weeks, because here in the US, 8 weeks old tends to be the age that our kittens become eligible for adoption. So I work with that population because they have very unique needs when compared to other age groups. They have really different vulnerabilities. They have different outcomes than post-adoption age kittens and cats, including that they do need specialized knowledge, skills, and supplies that are not always accessible within a shelter. They also are more susceptible to illness and rapid decline when they're exposed to pathogens. So, when we picture a vulnerable little baby kitten entering a shelter, there's all sorts of of pathogens they can become exposed to. So they are more susceptible to becoming sick, and they also have a more rapid rate of decline when they do become sick, meaning that we really want to keep these kittens out of the shelter. The best place for them really is a more quarantined space like a foster home. They also need close monitoring and swift intervention, which is a benefit of fostering. People are able to, be there with them, including overnight. And one little tidbit that I think might be interesting to you is that, with over 4,000 about brick and mortar shelters in the United States, there's actually fewer than 1% of them that provide overnight care to kittens. And so it is not really a reasonable expectation to say that, brick and mortar shelters should be caring for kittens on site around the clock 24/7. For those reasons, these kittens historically were quite vulnerable. But as community programs have really surged in our industry, we've seen that these kittens have been able to have much better outcomes. Kittens in the pre-adoption age category are a community-dependent population. Their outcomes entirely depend on our ability to engage and empower members of the community to sign up to foster and to continue fostering. That is how this population is able to have positive outcomes. So vulnerable doesn't have to mean hopeless for these guys. We just have to build strategic programs that are really centered around the needs of this specific population. But strategic planning requires data, right? Data is a really important thing to have so that we can internally plan our programs, so that we can externally communicate, what is the need and what is working and how can people help. Data helps us with program evaluation, measuring our impact, understanding what's working and what's not working, and of course, finding our opportunity spaces. So, data really helps us to save lives. And for that reason, I have spent my career just like trying so hard to find any reliable data on this population. And historically, it's been quite difficult. So I thought that maybe giving a brief history on data keeping in shelters and specifically with kittens would be interesting for you guys. So throughout the 20th century, data reporting was really variable. Animal shelters, maybe kept paper records, maybe they kept digital records, maybe they kept no records, but there wasn't like a national collection of data that was reported. That changed in 2004 when the Asilomar Accords were created. This was a group of organizations that came together and said, we need to create some common definitions here so that we can start to define what we're doing in our shelters and to create this standardized data matrix that shelters can use to track their impact. And so that made way for eventually in 2012, the creation of Shelter Animals Count, which is the wonderful organization that we're here with today, who were created to steward and share the national database. Amazing. So the early 2000s were a big moment for data, and we love that. However, there's some important context I want to share, which is that very few resources existed for neonatal kittens in the early 2000s. I feel that I can speak to this personally because it was the early 2000s when I got involved in kitten welfare. And I can tell you back then, it was not a given that shelters even had a foster program. If they did have a foster program, very few of them worked with young kittens, and especially the youngest neonatal kittens. Providing things like foster supplies for neonatal kittens just was not standard at all back then. And so when I got involved, it made sense to me that these little kittens were incredibly vulnerable. Being in an animal shelter was not going to be the best thing for them. And you can see when we look at the Asilomar Accords and the definitions that they created in 2004, you can really see that. So they were not included as healthy and treatable in those definitions. Healthy was considered to be, dogs and cats 8 weeks of age or older, which means that all of these little kittens you see on the bottom here were not included in those definitions. That meant that when shelters were reporting their live release rates, they were actually able to back out kittens from that data when reporting, what percentage of healthy and untreatable animals were being saved. You can also see that with the marking of kittens as UU, or unhealthy and untreatable. That was defined as kittens under 8 weeks of age and not likely to become healthy or treatable, even if provided the care typically provided to pets, which of course we know neonatal kittens need a lot more than the typical care provided to pets by the community. So this context matters a lot because it did make sense at the time that kittens were considered unhealthy and untreatable. But that made it so that when we have been looking like in the past at what the ultimate outcomes of these kittens were, it's very hard to find that information because it just was not always necessarily being reported like that. But times have really changed. I mean, it has been so profound to work with kittens over the last, decade and a half plus. I've been able to dedicate my life to this, and I have really seen a lot change. There's more kitten focused foster programs. There's kitten focused funding now through organizations like Orphan Kitten Club. There's access to training resources and kind of this surge in common, public education about just the existence of kitten fostering. So live outcomes for kittens have super skyrocketed over the last decade, or 2 decades, really. So now my feeling is we need to kind of update how we data keep, how we define what's going on with kittens, and really how we report what's happening with them so that we can understand what are our needs, what is our impact, where can we still continue to help these little ones, and how can we truly make every kitten count. So things have gotten better, but sadly, we still do have an industry-wide problem with reporting on 0 to 8-week-old kittens historically and in the recent history. We see things like data input issues, so kittens not being aged correctly. Sometimes they're not aged at all. A lot of the time in our software, we're not making age like a required category, so a lot of our kittens are being, entered with no age. Sometimes we're seeing them batched as a litter, so a group of 6 might be counted as one A number, which obviously is going to really skew our data. We do see, especially in rescue organizations, I hear people say that they don't enter the kittens until they've survived to a certain age, which means that we're not getting accurate data from that. And then a huge issue is diversion programs and not tracking the kittens who are coming through those programs, which means that, we're missing a big opportunity to see a full picture of our community need. Then we have reporting issues. So we do still have some shelters that continue to mark kittens as UU and back them out of that live release rate, which really makes it difficult for us to understand the community need for shelters that report in that way. We also have software configuration issues. So as the founder of a grant-making organization that specifically works with kittens, I can tell you we get lots of applications, and on our grant application, we ask for the intake and outcome information for 0 to 8-week-old kittens. And it is really astounding how many organizations, even when they're trying as hard as they can to, access funding opportunities, they report that they actually can't figure out how to pull the data on 0 to 8-week-old kittens. And for this year, from 2025 so far, over 50% of our applicant organizations have reported that they can't figure out how to pull those types of reports. So that is a big issue that we are working on solving. I'm going to talk about that at the very end. But then, nationally, when we're trying to understand what's going on, kittens have tended to be bucketed as 0 to 5 months. So, in the past, how it has been is that, we collect this data into the national database and we say, here's what's going on with adults and here's what's going on with kittens, but kittens was defined as 0 to 5 months. So for someone like me who's specifically interested in the 0 to 8-week population, it's been kind of impossible to disentangle their specific needs from that data. However, the new Shelter Animals Count animal level data API is really starting to change that. We have this really cool data upgrade now, and what that means is that we're able for the first time to look at national trends, specifically in the 0 to 8-week population. So if you work with a shelter or rescue that uses one of these 5 shelter software that you see, you can actually sign up through Shelter Animals Count to automatically have your data, your full data set going to them. And that gives them a much bigger picture of what's going on there, and they're able to actually create more specific age categories that we can look at. So that is some of the data that we're going to look at today. It's very exciting. But why does this matter so much? Well, for me, it matters because, I do a lot of kind of community education about what's going on with kittens. And historically, when we're talking about kitten season, for example, we were only ever able to report on overall trends. So we had maps that kind of looked like this, and we would say, this is total cat intakes over the course of the year. And look how it just like peaks in May and June, and it's got this mountain shape to it. But this is total cat intakes. We would look at overall species trends. And I would always kind of say, well, if we don't categorize by age, what are we missing, right? So I'm going to use some data from specific shelters in this talk. And the first is going to be from San Antonio Animal Care Services, incredible organization that data keeps like beautifully. And they shared their full data set with me, so I was able to create these charts using that. So with their chart, if you were to create something like this for your shelter and say, here's a look at total cat intakes, it's going to look very much like that national map, right? And historically, when we've done this, we've bucketed it out to 0 to 5 months and 5+ months, right? So let's take that same data set and look at it using these 2 groups. Wow, you can see that it is youth, these 0 to 5 month olds, who really are causing that spike, right? And adults are actually much more stable. So usually this is what we would have had, and that's it. And that's still pretty good. It makes the case for kitten season for sure. But I am promoting, and Shelter Animals Count is promoting kind of this new approach to looking at age. And that is to pull out the kittens who are pre-adoption age and look at them specifically. So this idea is to basically have these 3 age categories that would be kittens 0 to 8 weeks, juveniles 2 to 5 months, and then adult being 5+ months. Of course, the reason being that, a kitten who is under 8 weeks old, a little one like this, they have very, very different needs than, I'm so sorry, my kittens are causing mayhem. Kittens on the left category here have very different needs than kittens in the center here, right? So if we're able to look at the data specifically, we can do a lot with that. So let's take that same data set from this Texas shelter and let's put it into these 3 categories. Wow, right? So here we can see that actually juveniles, the 2 to 5 month category, is the lowest intake for this shelter. And it's pretty stable. It does peak a little bit, in July as those 0 to 2 month old kittens are aging up. But for this shelter, you can see that it really is 0 to 2 month olds who are responsible for this massive, massive spike. And I call that May peak Kitten Mountain. This is really when we are able to look at the data this specifically, and we can see, wow, this really is 0 to 2 month old kittens who are causing this spike. What an amazing finding. So what's exciting is that now with the new Shelter Animals Count API, this is something we're able to do at a national level. It is not using every single shelter in the entire country, but it's with those who are able to plug in through that API. And you can see it looks very much similar to the data I just shared from this Texas shelter. We can see that kittens 0 to 8 weeks old really are responsible for that massive peak, juveniles kind of following up as those kittens are aging, and then adults and seniors are quite stable. The other chart that they were able to create using this API that I just think is like so amazing is this look at the regionality of kitten intake. So you can see, something that we knew, I think, anecdotally in animal welfare, now we can put numbers to and say, listen, the South Atlantic really deals with kittens at a level that outpaces anything else in the country. And so as somebody running a national organization, that's really important information for me and my team to have. This is like an example of the real use of data. For us, we're already kind of going, okay, we can see with numbers where we need to prioritize now. Interestingly, this also shows that really across the board, May is the peak in every region. So very interesting. So what are the benefits to tracking 0 to 8 week old intake? Well, it's going to help you plan your programs so you can address the specific population's needs, because these guys have specific needs, whether that's on-site care, diversion programs, foster programs. It will also make the case for the important need to develop protocol for age-associated diseases. Little kittens have very different veterinary needs than even, kittens who are post-adoption age or adult cats. So, if you see that really high intake, it's going to kind of make the case for putting some more age-associated disease protocol in place. Setting effective and targeted budgets, and planning your seasonal hiring and your volunteer and foster trainings, and then of course obtaining appropriate supplies. That is something that if you don't know what age group you're working with, you don't know what you need, right? So this is going to allow you to do so much, and of course, importantly, to communicate to the media and community members in a timely fashion. So planning your community events, you can do this around what your shelter's chart looks like. That upper left photo is actually from San Antonio, and I went there in March, and I just thought, this is a very strategic organization, because they actually, took their map, looked at it, and said, okay, March is when we need to plan this big community event. And we were able to train hundreds of prospective foster parents. I also did a full day of trainings for people from the professional community around the city of San Antonio. So really, really strategic. Now, if you're doing your kitten shower or your kitten foster trainings in July for the first time, you are already possibly past the point where you had that spike. So using those maps is going to be helpful in so many ways, including hiring seasonal support. We have found at Orphan Kitten Club that our possibly biggest return on investment in terms of us providing a grant and then kittens' lives being saved is actually seasonal support. Kitten-focused programs, kitten-focused staff are really not something that we've seen a lot of in shelters in the past, and we're really working to change that and to fund staff positions for people who can specifically focus on this population. And I wanted to share one story from a shelter that currently has a staff grant from us right now. This is a shelter called the Runaways. They're a private shelter in Florida. And they looked at their map and said, in February is going to be the right time for us to hire this person, this kitten life-saving coordinator, with the goal of being able to take in more kittens from municipal shelters. Now, just since February, this person has been able to grow their neonatal foster network by 40%, and they're currently on track to meet or exceed their goal of 25% more kittens saved from municipal shelters. Now, when you look at that map and you see South Atlantic and what they're up against with kittens there, I think this is a really good use of data to see, what areas do we need to be doing this in? When do we need to be bringing these people in? And then measure the impact of that so that hopefully that can be repeated. So the new API also allows us to take a look at kind of the percentages of each of these populations in terms of intake. So right now we see that neonates are making up about 15% of cat intake in 2024. Weaned or transitional, I call them, these 4 to 8 week old kittens are making up 19%, and then juvenile 2 to 5 months are making up 23%. But when you compare to dogs, you'll see something really interesting. I kind of put this pink ring around it so you can see these are 0 to 5 month olds. So kittens, 0 to 5 months, make up 57% of shelter cats in 2024, but puppies make up just 29% of shelter dogs. This is something that sometimes people say to me, oh, you're the kitten lady. What about the puppy lady? And we just don't have as many puppies in the United States as we do kittens. So a deeper look at intake by age. Where are these kittens coming from? Now, if you work in a shelter, I know you already know the answer to this in your heart and in your bones. We see the buckets and the baskets and the laundry bins and every single vessel that people bring kittens to the shelter in, don't we? So we know, but data can actually help us express this to people who don't know. So where do most kittens come from? actually about 4 out of 5 pre-adoption age kittens are entering shelters as stray. So this is not, primarily owner surrenders, people, having an oops litter or, breeding their cat and then bringing the kittens to the shelter. This is primarily Good Samaritans who find kittens outside and then bring them to the shelter. And the younger they are, the more likely statistically they are to have been found outside. So I think this chart is really, really interesting. And it really shows, on the left there, that's that stray population, which just means these kittens were found outside. So when we think about cats and dogs and kittens and puppies, it's very clear that, we have a lot of community cats in the United States. We don't have a lot of community dogs in the United States, although some regions may have more than others. But community cats are the cause of so many of these kittens coming into our shelters. And I think this is something that we know, but we don't always connect. And so I think that data is a really important way to make this case. I will tell you, I work with my local shelter and I go there and I get kittens, and they always have the same kind of story. They were found outside without a mom, right? Found outside without a mom. And so what we started doing was saying, okay, where were they found outside without a mom? Give me an address. I want the information. And then I'd go back there with traps, and I would always find a colony full of cats who looked curiously like the kitten I'd taken from the shelter, right? So same thing here with Cherry. This kitten found outside without a mom. Well, we went back to where that kitten was from, and we were able to identify over 30 orange cats there. So we know in animal welfare that community cat prevention programs or community cat sterilization programs are kitten prevention programs. We know this, but policymakers and the general public don't. And so I think it is really important to show them that with data, especially, it can be so difficult to make the case to municipal leaders or to the state to have, state funding or municipal funding for community cat sterilization. I think that this is a very, very good data point to be able to show that, hey, in our communities, 80% of the kittens coming into our shelters, who are then, we're relying on taxpayers and community members to care for, and it's so expensive to care for, they're coming from outside. So I think that this is a really beautiful use of data to kind of illustrate something that we all know, but can have a difficult time explaining. I really think that data saves lives. And one thing that you can do with this is you can, collect precise information about your areas of kitten intake. You can actually create a hotspot map. And I want to share this really cool resource from San Diego Humane Society. You can find this at sdhumane.org/KRC, which is their kitten resource center, where they'll show you how to create a hotspot map. And you can actually use that hotspot map to do targeted sterilization. This is something that we have done in the past. And we really piloted this program locally here in San Diego that we call the Full Circle program. Basically, what this program does is gathers information about the origins of surrendered kittens. We offer traps and sterilization services to the finder, try to reunite orphans with moms where we can, but most importantly, actively sterilize the colonies where these kittens are found. And so that's something that we started here in San Diego and found to be so effective that we wanted to actually see, is this something that can be done at scale with our shelter partners? So we have piloted it with a number of shelter partners, and I wanted to share one example from Kansas City. This is from Casey Pet Project. In a 6-month period, they started asking when kittens were coming into their shelter, where did these kittens come from? Getting the data. They were able to identify colonies at 88 associated with 88 different kittens. And they were able to then send team members out to sterilize the cats there at an average of about 5 cats per kitten intake. So they sterilized a total of 429 cats associated with kitten intakes during this 6-month period. So huge impact, something that can definitely be done at scale, and really something to consider if you look at your data and you say, wow, wait a minute, most of our kittens are coming from outside. Okay. Another thing that you might consider tracking is queens and kittens versus bottle babies. Now, this is not something we can track nationally right now, but it is something that you can consider creating a category tag for at the shelter level. So if you are interested in tracking that kind of thing, some organizations do, and I wanted to share a couple of examples. These are two partner organizations that we have that have really vastly different ratios of bottle babies to queen-fed babies. On the left, you can see only 16% of kittens coming into this shelter are bottle babies versus the one on the right, where more than half of them are bottle babies. So tracking that might be a useful tool, something that you can use to guide your program planning, even your community messaging. You know, if you maybe need to be doing more community messaging about not leaving the moms behind, you know, going back and getting the moms. Maybe you want to start a trap loan program for people who bring in kittens so they can reunite them. Maybe you want to change your foster recruiting because, wow, now we can see which types of foster homes we need. It's going to inform everything about the supplies, the training, all of it. So I do recommend that you create a category tag and you actually track queen-fed kittens versus bottle babies. Okay, now we're getting to the outcomes portion, and I do have to have a big caveat here, which is that our outcomes data is not perfect, and it'll take a second to explain, but stick with me. Essentially, the outcome data we have nationally right now is outcome by age at outcome. So what that means is when we're looking at what the outcomes are of kittens, we're only able to see what happens when it happens. And of course, that means adoption, which typically happens after 8 weeks. You know, we don't know how many of the 0 to 8 week olds who make it past 8 weeks are adopted, how many of them are transferred, how many of them, you know, ultimately are euthanized or die in care. We just don't know. What we do know is what happens to the 24.8% of pre-adoption age kittens who have their ultimate outcome while they are still in that age category. I hope that that makes sense. Basically, if you are a 0 to 8 week old kitten, you come into a shelter and you have your ultimate outcome under 8 weeks, we have that data, and that is about close to 25% of kittens. So this is a big opportunity space and something that Shelter Animals Count and I have been chatting about. You know, the desire to eventually be able to report outcome by age at intake, but that is something that you can do at the shelter level with many softwares. You are able to actually pull outcome by age at intake. So that is something that you can do with your shelter data. But I'm going to show you now our, you know, our imperfect data for outcomes by outcome age nationally. And obviously you can see that we don't have a lot of, you know, we only have a quarter of the information on the ultimate outcomes of 0 to 8 week olds. And of course, for kittens who are having their ultimate outcome under 8 weeks, the majority of those are going to be non-live outcomes, so euthanasia or died in care, or transfers out. You know, adoption, I was surprised to see some adoption under 8 weeks. I think that probably represents foster to adopt, or perhaps there are certain rescues or certain regions that are adopting out under 8 weeks. But for the majority of what information we do reliably have right now, it's going to be transfers and non-live outcomes. So we're going to kind of look at what that looks like for kittens. So transfers out by transfer age, we see something that is exactly what I would have suspected, which is that transfers play a major role in saving the lives of 0 to 8 week old kittens. In fact, pre-adoption age kittens rely on transfers more than 2 times than any other age group. So that makes a lot of sense. You know, if you are a huge open intake shelter and you don't have the ability to take care of every single kitten coming in, that is why we have those transfer programs where they're transferred out to private organizations or foster-based rescues. And so we see that about a quarter of 0 to 8 week old kittens in all types of organizations are transferred out. So that is a really interesting finding. I also think anecdotally, it matches with a lot of what I see. I look at a lot of shelter data and I talk with a lot of shelters. And what I notice is I have noticed that shelters that have fewer transfer partners do tend to have lower live release rates for kittens 0 to 8 weeks. So something to really consider is, your transfer partnerships. Now, when we look at non-live outcomes by outcome age, we do see that 0 to 8 week olds absolutely do comprise the highest volume of non-live outcomes of any age group. And this was really, really affirming information for me to see because it's something that, it's only so powerful to say it as an anecdote, but to be able to actually see it is very, very illuminating, right? So, we have about 173,000 deaths of 0 to 8 week olds for last year. And then that dramatically drops at the 2 to 5 month range. They actually are the least likely to have a non-live outcome, right? So we don't have perfect information about outcomes, but I think that we do have pretty good information. Some of the things that we can say about outcomes, if we're looking to be able to speak about, what are the ultimate outcomes of kittens, we can say that kittens under 8 weeks old are the most likely to have a non-live outcome of any cat population. We can say that on the whole, over 2.5 times as many individual kittens are dying pre-adoption age as opposed to post-adoption age. And then we can say that as a percentage of their total intakes within each age category, pre-adoption age kittens are more than 3 times more likely to have a non-live outcome than post-adoption age kittens. So some really, really good kind of like facts that we can put to this. So if pre-adoption age kittens are, about 3 times more vulnerable than post-adoption age kittens, and we know that their outcomes rely so much on our ability to communicate need to the public, I think it's really essential that we be able to really accurately paint a picture for members of the public to help them understand how important foster care is, because foster care ultimately takes kittens from being the most vulnerable they'll ever be to being the most adoptable they'll ever be, right? It's a short-term thing we're asking people to do that has this impact of bumping them into an age category where they are highly likely to have a live outcome. So with that said, how we report our outcomes matters a lot, because this is how members of our communities can understand what's going on, right? So we're going to now take total outcomes from a municipal shelter. We're going to take that data and we're going to look at a couple different ways that we could report it. So this is some 2024 data from a municipal shelter. And if we just report out total cat outcomes for all ages of cats, this is what the data looks like for this one shelter. And you would say, wow, amazing. Their adoptions look really strong. We do see some euthanasia that we hope will go down over time, but really strong adoptions. And that's, what we would kind of see here. Now, if we take that same data set and we do our youth versus adult, which is, what we've historically done, 0 to 5 months, 5+ months, then their data is going to look a little bit like this. And it's the same exact data set. So you would say, wow, okay, so there's more euthanasia in the 0 to 5 month category, but there's also way more adoption. So perhaps it's just that there's a lot more kittens there, right? So more adoptions, more euthanasia, but in general, these outcome trends appear somewhat similar between the youth category and the adult category. Now, here is where you can probably guess what I'm going to say, which is that I strongly encourage you to actually report on 0 to 8 week old kittens, these pre-adoption age kittens. So now we're going to take that same data set, we're going to separate it out into 3 categories, and this is what we get. So this is a really important thing to help our community members understand, right? That in this case, you can see that under 2 months, these kittens are the most likely to have euthanasia, and over 2 months, they're the most likely to be adopted. Really interesting chart to look at, and really makes the case for why combining these 2 things together just doesn't make as much sense as having them as 2 different categories. Now, this is a really good opportunity space. If your data looks like this, then certainly where to start focusing a little bit more of the program strategy around possibly that population. So I really am a big fan of kind of this level of transparency for the community. And I think honest communication with the community is so very important. This is a couple that I was working with a shelter, and these guys walked in with a bucket of kittens, literally like a a bucket and said, we found these kittens outside, and that's the main way that kittens come into the shelter, right? In buckets with nice people. And fortunately, this animal shelter has a diversion program, and they said to them, hey, if you leave these kittens here, it's quite likely or possible that they might not survive here. So would you be willing to sign up to foster them and take them home? And these people said yes. Now, diversion is an amazing opportunity. I love that. And these kittens ultimately were able to be saved because of the compassion of these community members. But if we don't have honest discussion with our community members, then, people don't primarily sign up to foster because it's cute. They sign up to foster because they're motivated by the cause. They're motivated by understanding what's going on. So diversion programs are a big piece of kitten welfare. And I have started kind of pushing for more conversion programs than diversion programs. What I mean by that is in diversion programs right now, they're kind of turn away programs a lot of the time, aren't they? It's like, hey, will you take this kitten home? We will give you some supplies. We'll train you really quickly, but please take them home and don't bring them back, right? And so these kittens don't get an A number. They're not entered into our data. But also that means we can't build a relationship with these people. So I'm a big fan of conversion. So can we convert this person? And I know there's a lot that goes into that. I'm going to give you a pilot example in a second here, but the importance of tracking that finder to foster data can't be overstated. It's going to help you assess your actual community need to know what's going on, like how many kittens are actually being brought to us versus those who we, maybe take as an intake. How many of them are we at least supporting as a diversion? Can you track that somehow? Measure your impact and plan for the future of your diversion program. So okay, this is what we did this year. Next year, here's what we need to have in terms of supplies, training, maybe staffing. It also, if you track that data, you're able to offer an on-ramp into actually becoming a full foster parent, which would give them more support, hopefully help these kittens access sterilization. And very importantly, it will help you recruit these finders to continue fostering. Now, I did a survey in 2018 that found that 76% of people who fostered at that time in 2018 didn't just sign up to foster. They started fostering because they found a kitten outside. And I will say that's the same thing that happened to me. So finders are a very ripe group from which to recruit. But so much of the time, we're kind of turning them away. We're not getting the data. We're not getting their information. So it is a real opportunity space, in my opinion, to really kind of hone in on how we do our diversion programs. Do we make them into conversion programs? So what do I mean conversion program? Let me give you an example from Orphan Kitten Club. So this one is from Fort Wayne Animal Care and Control in Indiana, where we funded a field foster program. And what this did was basically they had officers go to where people were finding kittens, and they brought them a kit of supplies and said, can you hold these kittens for 3 days? We will take them into foster, but we need 3 days to find them a foster home. Ultimately, they found that a lot of people, after having the kittens for 3 days, found like, actually, I can do this. And they wanted to be onboarded as foster parents. In this program, they were able to assist 103 kittens in 39 new foster homes who ultimately had said, yes, not only can I help them for 3 days, but I'm going to help them, through the length of their fostering. And think about 39 new foster homes, like even if half of those stick around and continue fostering, what an amazing win, right? So when we're dealing with foster parents or when we're dealing with the community or finders, we can also use data to survey and find out, what do people need? I did this last year. I did a survey of over 1,700 foster parents and asked them, what would help you continue fostering kittens? And overwhelmingly, timely medical care was the answer. We also had training and mentorship as a close follow-up, right? So what does this tell us? To me, it tells me that foster parents want to feel supported. They want to feel that we've got their back as an industry, that if they sign up to foster with us while they're doing this very brave thing. And I like to remind people in the industry, because for us, maybe it's not so scary to take care of a neonatal kitten, but we're talking about, just nice community members, baristas, librarians, school teachers, Uber drivers, like people who are just members of the community that find kittens. And we're asking them to take care of these fragile babies. And what they want over and over again, they report they want to feel supported, right? They want timely medical care. And on my survey of ex-foster parents, over 40% of them said that poor access to medical care was their primary reason for quitting. So this is very interesting, and it does kind of follow a lot of what I see. But I want to now share with you what I thought was the most astounding statistic to come out of the Shelter Animals Count API, which is about the subject of unassisted death. So, what do I mean by unassisted death? I mean animals who come into a shelter and have a non-live outcome, but they were not euthanized. So they died naturally, right? That is going to happen sometimes, but we see that it is overwhelmingly happening to kittens. In fact, close to 90% of unassisted deaths last year were kittens 0 to 5 months old. So natural death is painful for the kitten. It is also incredibly traumatic for the caregiver, especially if this is a nice, sweet member of the community who has bravely said yes, and then they have to go through watching this traumatic thing happen, right? So a lot of ex-foster parents report quitting after experiencing a traumatic loss. And I think this data point can really help us understand what experience are we giving to our foster parents. Because we talk a lot about foster recruiting, but we talk less about foster retention. I think it's important to retain people, right? And I think that, trying to address this unassisted death issue actually is an important foster retention strategy. So let's zoom in on this a little bit. On the left here, we have under 2 months old, and we have euthanasia versus died in care. Died in care meaning unassisted death. And then on the right here, we have over 2 months old. We can see that still 11.5% of deaths of post-adoption age cats are unassisted, but it's a sliver, it's 1 in 10. Kittens under 8 weeks are actually 4 times more likely to die unassisted than cats who are post-adoption age. For me, this is a really astounding statistic, and once my organization found this statistic, we actually made a lot of changes. We created a quality of life guide for our shelter partners to help them make decisions around euthanasia and kittens. We started looking at that within our specific shelter partners to see where we can help address some of these things. And I want to show you how different it can be. This is an example of 2 different shelters and their data. We ask for this, we call died in care percentage now, or DIC percentage. This is looking at all of your non-live outcomes, and then what percentage of those were natural deaths for 0 to 8 week olds. You can see on this recent applicant shelter, it was over 91% of kittens who had a non-live outcome, having the non-live outcome of dying naturally. On the right, we can see a close shelter partner of Orphan Kitten Club has more like 25%. So it is still more than the, adult cats, but less than the average. I think this is a really cool thing that you can do with your shelter data is, pull this percentage for your 0 to 8 week old kittens and see what it is for you. If your chart looks more like the one on the left, maybe you want to start considering, what is the foster parent experience and how can we help shape that for the better? Is it that we need to have a grief program? Is it that we need to have better overnight support, better training for foster parents to recognize the signs of decline, better access to overnight euthanasia services or stabilization services? So we've been trying to kind of do some case studies with shelters around the country on solving for this issue. And I want to share one that we just got statistics for that I'm really happy with. This is Companion Animal Alliance in Baton Rouge, Louisiana. And what you can see is that we did a 24-hour overnight program that was a partnership funded by us between them and 24-hour hospitals to provide either euthanasia or stabilization to kittens in foster care overnight. And so it was pre-approving, certain basics or providing euthanasia. And what they said was they saw a 62% decrease in their deaths, their unassisted deaths, a 50% decrease in euthanasia, and an overall 25% increase in their total life outcomes for kittens. And this is not even accounting for the fact that they had a big spike in their intake. So it was a really, really cool finding, something that I'm really pleased with the outcome of this program. And something that you might consider modeling is just kind of how can we provide a bit of overnight support to our foster parents and help them feel that they can provide the best possible care. Okay, so let's look at mortality rates by age group here. So, on the whole, kittens 4 to 8 weeks are representing the highest number of non-live outcomes for shelters. Within each age group, they do fare worse the younger that they are. But interestingly, euthanasia is quite a bit higher for our 0 to 4 week old kittens than our 4 to 8 week old kittens. But our unassisted deaths are about the same for our 0 to 4 and 4 to 8 week old kittens. So, what can we make of that? What I make of that is that all kittens in foster care, regardless of whether they're in the neonate group or in what is currently being called the weaned group, that all of these kittens do need better support. We need to be doing a better job of supporting our foster parents. And part of that is going to involve training our staff to identify the age and development of kittens. So obviously we need to know what age our kittens are to be able to enter their data and estimate a date of birth, but also knowing their stage of development matters a lot because things change for kittens very quickly, week to week. And we unfortunately do see that about 55% of foster parents report having received kittens who were not properly aged or who they were told were at a stage of development that was not accurate. And that can really lead to frustrating and even deadly outcomes for these kittens. So I do have information at kittenlady.org/age to show you kind of how to age kittens and also what are some of their kind of key developmental markers during those times. But I want to just very quickly mention one trick that you can use when you're training your staff for identifying the difference between 4 and 5 weeks, which I really believe if we could even take this data and make it even more specific to week by week. The 4 to 5 week age range is a very, very vulnerable one. So look in this kitten's mouth. This is a 4 week old kitten. We don't see any premolars in the back, right? No teeth in the back. We just have the incisors and the canines. This is by aging by teeth, you're going to be able to actually get an accurate age and an accurate sense of their stage of development. Our 5 week old kittens are going to have those premolars, those big sharp teeth in the back. That is a really good sign that these kittens are actually at a developmental stage where they may do good on starting to wean. But unfortunately, we see a lot of kittens who are under 5 weeks old, these like 4 week old kittens being sent home only with wet food. And it ends up looking something like this. And I know that this looks really funny to a lot of people, but for me, it actually is very, very sad because these are all kittens who are really struggling. This is not what weaning is meant to look like. Weaning doesn't look like this when the kitten is weaned on a timeline that is kind of natural for them. And unfortunately, we do see a lot of these kittens have non-live outcomes, pass away in foster care or require euthanasia because they don't do well with this kind of rushed weaning. So that is why for that 4 to 8 week category, I do refer to this category as transitional rather than weaned. It worries me to picture, a new employee coming into a shelter and seeing like 4 week old equals weaned, because it certainly is not the case. 4 to 5 week old is a good chance to maybe like start introducing a bite or two of wet food here and there, but 5+ weeks really is when we can start to expect a little bit more from them. So kitten-led weaning is a thing that I'm a major, major advocate for. It's part of why I wanted to put it into this talk, is just to mention why we might see some of that vulnerability still in the 4 to 8 week category. I think a lot of it has to do with weaning. And you can see in this video, I'm kind of providing kittens wet food and bottle, going back and forth. It's a multi-day process that involves really close handling and observation. You can, provide scales to your foster parents, require daily weighing, and just demystify bottle feeding, because it really, ultimately is not the end of the world for foster parents to provide 1 or 2 bottles a day. Okay, so Are worse outcomes for pre-adoption age kittens a given? No, they are not. This is data from Jacksonville Humane Society, an organization that I really love and respect. I got to visit them for the first time about a decade ago, and they already were really ahead of the game in terms of kitten programs. I was there in December and saw the same. Just they have programs that are really, really targeted towards this population. And interestingly, they also do a lot of great community education, kind of being honest. I saw a post from them the other day saying exactly how many kittens were awaiting foster there, and just being honest with people about here's our community need. So take a look at this. I mean, you can see that when we take their data and we put it into these different categories, and this is actually outcomes. This is outcomes by age at intake that they were able to pull for me. So also great data keepers over there. And you can see most of their kittens that enter under 8 weeks are being adopted. So phenomenal program, really something that you can look to see that, yes, when we build kitten programs, we save kitten lives. That's just true. I wanted to end with an example from Kansas, from Lawrence Humane, because this is an organization that both Hills and Orphan Kitten Club and I myself personally have worked with for years, very near the Hills headquarters. And so they do a lot of work with Hills, and they also have been supported by a lot of different Orphan Kitten Club grants. We funded everything from kitten focused staff to the supply shed you see down there on the right, which is like filled with kitten supplies their foster parents can come access. And what they said is that their live release rate over the last 5-6 years has jumped from the 80s to 95%, and they're stable at 95% for live release for 0 to 8 week old kittens now. So it can be done. It can be done with a lot of care and funding and effort, but it can be done. We see it being done, and it's a beautiful thing. So vulnerable does not have to mean hopeless. We have to create the conditions of hope. And I really believe that a lot of that starts with being inquisitive about our data. So I'm wrapping up here. I have a couple more slides, but this is the really important part. If you work for a shelter, please keep good data. So what does that mean? What does keeping good data mean? It means, one, ensure that age is a required field. You can actually go in, and if it's not a required field, you can actually configure your data software, your software system to make age a required field, and train that into your intake team, that they have to put age. Please put date of birth rather than category tags. Have them, estimate a date of birth. Train your team to correctly age kittens. You're welcome to use kittenlady.org/age to find information on that. No batching of kittens as a litter. Every single kitten counts as an individual. Capture bottle babies versus queen fed. If you want to create a category tag for that, I would advise that. Capture the origin locations of your kittens, perhaps make that hotspot map, or plan on going out and sterilizing those colonies. And then track your diverted kittens, even if it's not that they're getting an A number, even if you just have a spreadsheet where you put the finder information and the number of kittens that you are serving through your diversion program, please do track that. It really is important. But remember, garbage in, garbage out. That's what we say about data. If you enter it incorrectly now, later when you want to, pull that information, it's going to be garbage if you didn't enter it correctly. So really train entering the data correctly into your teams. Once you're able to look at your data, you can discover your opportunities. So look at your year month by month. Look at what your 0 to 8 week old year looks like. You can look at those age categories in comparison to one another and use that to assess your trends, guide your budgets, guide your staffing, guide your programs, how you're going to community message and when you're going to community message. Definitely pull your non-live outcomes for 0 to 8 week olds and look at that diet and care percentage to guide what opportunities you have to help support foster parents more, whether that's better medical access, updating your quality of life protocol, providing more training. You can also assess trends in intake source. So if you are seeing those really high stray intakes, use that information to guide your community cat programs. And please remember, when you're pulling your outcomes, do it by age at intake if possible. And then engage your community, be honest with the community about, your needs. Don't back these kittens out of the data. You want to report on your whole outcomes, noses in, noses out. That's going to be much more motivating for people. You can survey your community to find out what they would want to be able to help you. You can make it easy and enjoyable for people to help by just, asking them what do they need and then providing those things to them to the best extent that you can. Obviously, things take time. We're all, growing our programs, but how can we make an improvement this kitten season? And then certainly use data to advocate strategically to policymakers, to funders, to the media. When we just kind of wax poetic about how sad it is what happens to kittens, I think that is, storytelling is one powerful thing, but having numbers to put to it is really, it's a really, really powerful tool that we have. So if you work with a shelter or rescue and you're having trouble pulling your kitten data, we've got your back. Orphan Kitten Club and Petzl have teamed up to create a guide to configuring your data for 0 to 8-week-old kittens, starting with focusing on the ones that we were seeing a lot of shelters say they were not able to figure out. So we have guides for Chameleon, Pet Point, Shelter Love, and Shelter Buddy will be coming soon. You can find that at kittenlady.org/data-configuration. Take a picture of this slide. If you use those softwares and you don't know how to pull your 0 to 8-week-old kitten data, we've got you. And hopefully we'll have more of those to come. And then please do contribute to national data. Contributing to shelter animals count is why we're able to look at these trends. So if you're not already doing that, please start. And if you have one of these shelter softwares, Pet Point, Pet Established, Shelter Love, Animals First, or Animal Shelter Manager, those are able to plug in with the API. So please go to shelteranimalscount.org and make sure that you opt in to that API. That's how we're going to be able to do this more strategic, specific data analysis. Now, if you've watched this and you've thought, wow, how can my organization partner with Orphan Kitten Club? We are onboarding more organizations this summer. So you can find out about that at orphankittenclub.org/apply. And I will say that we, as soon as that regional chart came out, we decided that chart is going to guide our summer onboarding. So if you are in a region of high kitten intake, such as the South, we want you to apply. Please do apply at orphankittenclub.org/apply. Now, if you're watching this and you're not from an animal shelter and you just want to support our efforts, you can go to orphankittenclub.org/donate to support our mission to improve shelter outcomes for kittens. I truly believe that together we can fix this. I think that it's been an amazing, 2 decades for kittens. And I think that we have a long way to go still, but this data really can help. So please contribute to the data, analyze your data. I hope that you guys found something of use in this class today. Here's where you can find me at kittenlady.org. You can also find my nonprofit Orphan Kitten Club at orphankittenclub.org. And again, I just want to really say thank you so much to Shelter Animals Count and to Hills for putting this on. Thank you, guys.